how do we address those needs in such a way that it does what we really want it to do? And I have some concerns. I have people that come into my office, as well do my colleagues, of people with intellectual disabilities, people with children with severe developmental disabilities, and we should, and I have voted to support waivers to include those children, and I think we need to do more to help the children that have these issues and these needs, and we voted in favor of that. Many Republicans have voted in favor of that. My concern here that we need to be careful how we define Medicaid expansion, because it means different things to different people. Medicaid expansion to some people means we're going to give health care insurance to everybody, even able-bodied individuals. And my concern with that is that we would end up diluting the help for those people who really need it. The one thing that's very different from the federal level, at the federal level, they can just raise the debt ceiling. We can't do that at the state level. We must balance our budget every year. And so if we've take a look at our state budget and the amount of money that the percentage of our budget that now goes to Medicaid, it's gone from 2% to 22%. If we expand Medicaid, what percentage of our budget is going to go to, and what is it going to crowd out? What other services, and do we, let's talk about education. I know many of us in this room want to make sure that we protect the education for our children. I'm a mom of 4, and I don't want to see cuts to education. What about transportation? I mean, it doesn't take long to know that we have major infrastructure needs. We have bridges in my district that you can't even drive ambulances over or fire trucks over because of the crumbling infrastructure. And I could go down the list. So we have a very important decision to make today that's not whether or not we care about people. It's a matter of limited resources and how do we carefully manage those resources to ensure that the resources are for the truly needy. And I'm concerned that we are putting at risk by expansion to able-bodied individuals. One thing that I think we need to do, I've introduced legislation that we have not discussed today called the Healthcare Transparency Cost legislation, and that is to shed light on the cost of healthcare, which is out of control. And I think everybody can agree on that. You can go to any other industry and you know what the cost is going to be for healthcare, except for healthcare. We need to have a no excuse mentality, whether we expand Medicaid or not, unless we address the anchor issue here, which is the cost of healthcare. It's going to explode out of control. We have to get control over the healthcare in Virginia. And so I would encourage your legislators to support the bill that I've put forward as well, the healthcare transparency costs, so that when you go to the doctor, instead of you just giving them, let's say if you have insurance, if you give them the insurance card, they typically tell you to sign on the dotted line that you have to pick up whatever cost your insurance company's not going to pay for, and you don't even know what the number is. And the doctors who want to give it to you, they can't even give it to you. That's unexcusable. We cannot continue down that path. We must expose the cost of health care. Okay, and those are my comments. Thank you.
Senator Chase, thank you for your comment. Senator Howe.
Thank you, Mr. Chairman. I wasn't planning to speak, but I think Senator Chase has it exactly backwards. By expanding Medicaid, we not only show mercy to Virginians and provide them health care, but if we're to look at it strictly from a financial point of view, we will benefit our state treasury. We will be able to bring back $423 million that we wouldn't have otherwise. It will cost the state nothing. The federal government would be paying between 90 and 94%, and we would have our hospitals pick up the difference. So the cost to the state would be zero, but the net benefit would be $423 million. And what would we do with that $423 million? We could put it into Medicaid waivers. I agree with her. That's an absolutely top priority. We could put it into education. We could put it into programs for people with opioid and other addictions. We could do a lot to help the people of Virginia, but if we keep refusing to accept this federal money, we have put ourselves in a box where we will suffer in Virginia as a result.
Thank you, Senator Howe. Senator Sasslaw.
Yeah, I would just say this, that Senator Chase mentioned the education. If we don't expand Medicaid, $421 million comes out of the general fund because that was in the introduced budget. And K through 12, I think, is about 30% of the general fund. Senator Hanger, correct me if I'm wrong, but I think it was came out to about 30%. So that would mean that if we don't pass Medicaid expansion, coming out of K through 12 is $120 million right off the top. And I can tell you as a businessman, if somebody came to me and said, Sasslaw, we'll pick up 90% of your medical insurance cost if you pay the other 10, and we think we have even a way around that 10, as Senator Howe mentioned, I'd have to be a lunatic to turn down that offer. And the point is that 31 states have expanded it. West Virginia, Kentucky, Tennessee, states, and Maryland, I don't think North Carolina has. So essentially all the states surrounding us have, including, southern states, border states, have done this. And it's just a big mistake for us to continue to buy into this. When you get some of the, virtually everybody in the medical profession, you got the hospitals coming in here, those people walk into that emergency room, and usually they come in when it costs a lot more to get them well, Mr. Chairman. And don't think that we're not paying for that. That shows up next year when you get your insurance bill, is that cost of them going into that emergency room. So make no mistake about it, we're paying for it.
Thank you, Senator Sasslaw. Senator Black.
Just very briefly, Mr. Chairman, one of the problems that we've got, and I think everybody recognizes, is there is a degree of uncertainty at the federal level as to what's going to happen. Honestly, I honestly cannot predict for you what will happen. Will the program be done away with? Will it be entrenched? I just don't know. And I think really it is premature, regardless of what your views are. I think it's premature for us to move forward on this and potentially get ourselves stuck in a situation where we have expanded and all of a sudden we're having to do this thing on our own dime at enormous expense. We all know that the Medicaid program is perhaps the most fraud-ridden program that we've got in the federal government, and so the cost escalates. It's not all the fault of certainly of the states. To some extent, we've got just gargantuan problems with the way that we handle pharmaceuticals and the vast cost to those. But in any event, I just think that it is premature for us to take action when we just do not have any idea what the feds are going to do.
Great.
Mr. Chair?
Yes, Senator Barker.
Yeah, just to address a couple of issues that have been raised. The bill that I have, and I think the other bills, have a provision in there that says if the federal government changes the percentages, we pull out.
Got it.
So that is built in there. So our plan would go away if the federal government ever changed the percentages, which right now is a 90-10 shift.
Right.
So it's not something that we are going to be left holding the bag. We have addressed that very directly here. In addition, I would say that the Medicaid program is by no means fraud-ridden. We have an extraordinarily strong program in Virginia. It's regarded as one of the best Medicaid and one of the best Medicaid programs in the entire country, one of the best managed, and one of the ones that really does not have any significant fraud issue. Okay. So I think those are mischaracterizations, of the program that we have.
Senator Barker, thank you very much. Senator Chase, we're going to.
Thank you, Mr. Chairman. I'm just going to make a couple final points here. Number one, I would say that coverage does not necessarily equal care. I can't tell you the number of my constituents who are on the Affordable Health Care Act, and they are paying incredibly high premiums, but they still don't go to the doctor, just like Senator Donovan said, because they have to pay so much out of pocket. It's not affordable, and yet we want to expand it. I want to point this to you. Medicaid actually, according to the Galen Institute, they have a report here, and you can refer to it later, it actually harms the poor. The Medicaid program is so badly broken that it actually harms the people that it's intended to serve, and there are mountains of literature. I know we talked about the University of Virginia and what a great institution that it is, and I agree with that, but the largest such study by far was conducted by surgeons at the University of Virginia. They examined the outcomes for 893,658 individuals undergoing major surgical operations from 2003 until 2007, and listen what they found out. It found that patients on Medicaid were 97% more likely to die in the hospital after surgery than those with private insurance, even when adjusting for age, gender, income, region, and health status. Medicaid patients were 13% more likely to die than those who are uninsured. And that's because, listen to why, the Medicaid program pays doctors and hospitals far less than private insurers do, leading more doctors to drop out of the program entirely. In 2008, the Virginia Medicaid program paid doctors 29% less than private insurers did. In states with expansive Medicaid programs like California and New York, Medicaid pays doctors 62 to 71% respectively. When Medicaid patients can't get predictable access to care from physicians, their cancers go undiagnosed, their heart conditions go unmanaged. Virginia should instead insist that Washington and other states provide more flexibility with Medicaid spending so that the Commonwealth can provide them the dignity of private insurance. We need to look at private insurance and taking these block grants instead of expanding a system that is already broken and does not provide health care. Thank you, Mr. Chairman.
Great. Any other comments? If not, Mr. Chairman, you good? Or you want to say something real quick?
I won't impose. You've been very courteous. It seems like we almost were skewing off the track here a little bit with some things that I could rebut, but I won't at this point in time. The Medicaid population, the low-income people, do die more frequently in the hospital because they haven't had preventive care, and they come in with extremely unmanageable cases. Yeah, thank you. And I apologize. Thank you.
All right, great. With that, there's a motion to roll Senate Bill 158, 282, and 956 into the chairman's 572. Second. There's a motion and a second that we roll those bills into the one bill. All those in favor will say aye. Aye. Opposed, no, and those are rolled in. So that includes Senator Edwards, Barker, and into the Hanger bill. Is there a motion on the rolled-in bills? There's a motion that the bill be reported. Very good. And any discussion on that? Just briefly, yeah, if it passes. So the motion is to report and refer to finance. And I'll be very, very brief. Guys, we're going to look at these bills. We're going to look at the Donovan bills next week. Senate Finance has some bills. I know the House Appropriations is thinking about another set of bills. So we are entering round one, and I know the governor is very much involved as well. So those of you in the audience will have multiple opportunities to kind of find our way to get there. With that, unless there's other discussion, the clerk will open the roll on reporting Senate Bill 572. Clerk, close the roll.
Yeas 7,